morning. My name is Savannah. I'm going to be the nursing student caring for you today. I'm going to be administering cefalozocin on you per the provider's orders. Some common side effects of that is just nausea, vomiting, and diarrhea. And what that is it's an antibiotic to help with your infection. But before I administer it, I'm going to go ahead and do a very quick safety check by making sure your bed is in the lowest position, it is locked, your floor is cluttered free, you have 3 of 4 side rails up, you have your call light if you were to need anything, and you have your bedside table within reach. I'm going to go ahead and ask you a few questions. Can you confirm your name for me?
Abby Corlin.
All right, Abby Corlin. And how old are you?
25.
I see here, 25. And do you have any allergies?
No.
All right, and your MRN number is 7852361, and in the chart it's 7852361, so everything matches. I've already done my first and second med check, so I'm going to go ahead and do my third by coming to the provider's orders, making sure I'm in the right patient's chart, which is Abby Corlin. And I see here cefalozocin 1 gram by IV every 8 hours is ordered, and I'm going to confirm that with the MAR. Again, cefalozocin ordered for now, 1,000 milligrams IV piggyback every 8 hours. I'm going to go ahead and scan this in as part of my third med check. Alright, and now that everything is scanned in and charted, I'm going to go ahead and get my tubing ready. I'm going to check and make sure that there's no leaking, there's no tears at the bag, that the color is clear and there's no sediment, and check the expiration date, which is January 1st, 2023. I'm going to go ahead and do the same thing with my tubing, just making sure that there's no kinks, the cap is on, and that it is clamped off. After I do that, I'm going to go ahead and spike my tubing. Connecting this and filling the drip chamber halfway full, like so. Alright, I'm going to come here and prime my tubing. Alright, and now that that's primed, I'm going to go ahead and check and make sure that there is no air bubbles. And there's not. So I'm going to go ahead and hang this right here. Alright, I'm going to go ahead and lower my primary bag. And I'm going to get some gloves and wash my hands to cleanse the wine port with some alcohol. I'm going to go ahead and cleanse the swab port with alcohol for 15 seconds. Alright, and then after that is clean, I'm going to, without touching this, connect my tubing. Go ahead and make sure that my primary tubing is clamped off. And I'm going to go ahead and set the rate, the volume to be infused 50 milliliters per what's on the bag, and the rate is going to be 50 as well, so it will infuse over 1 hour. Going to unclamp this and make sure that my primary is unclamped and unclamp that slowly. Go ahead and start my secondary. Alright, I see that everything's unclamped, there's no occlusions. This is stopped and my secondary is going, which means that everything is correct. I'm gonna go ahead and take off my gloves. And label my tubing. I'm gonna label it with the date, my initials, and the day that it should be discarded. And I'm going to document everything that I did today and initial that as well. Alright, Abby, I'll be back in an hour once these are finished, but if you need anything in the meantime, do not hesitate to call me. Again, you may experience nausea or vomiting with this antibiotic, and if you do, please call me and I'll come in here. I'm going to go ahead and make sure your bed is locked and it is in the lowest position. Your floor is clutter-free. 3 of 4 bed rails are up. You have your car light and your bedside is near. Thank you for letting me care for you today. I'll wash my hands.